Kansan is somebody who's hardworking, who's honest, somebody who's loyal. They love their family, they love God, they love the country, and they're good people.
The typical person in the state of Kansas wants to help their neighbor. They want to help their family member. They want to make sure that everyone is taken care of. You see people all the time put out pickle jars. People put money in those pickle jars to help their neighbors and their friends pay for their health care. Unfortunately, so many of our community members, even when they're working 40 hours a week or more, even when they have multiple jobs, wages are just not high enough for them to be able to qualify for insurance.
My name is Stephanie Barr. I've always loved to collect vintage things. The first pair of glasses I ever got at thrift store was this one, and I used to wear these and drive around in my pacer. I thought it was so cool. I'm from Salina, Kansas, and currently me and my cat live in Overland Park, Kansas. I always had a dream that I would grow up one day and become an author. My mom was a waitress. She's a very smart person, but education wasn't a top priority. Even for my grandma at the age of 12, she had to go make her own way. We were really poor.
This is me at one of my jobs.
And so when I turned 14, I was able to get my first real job as a busgirl at Russell's restaurant, the truck stop that my grandmother managed. I made $4.25 an hour, and that's how I was able to buy those things that we needed at home, like new shoes or shampoo. I dropped out when I was a junior. Even though I was smart and I did well in school, I was in the gifted program, I didn't see any way for me ever going to college. It just didn't seem like even an option at all. When I was 30 years old, it was actually the first time in my life I was feeling pretty stable, and it's when I first felt the lump. I was diagnosed with breast cancer, and I just remember being in this hallway and feeling my world fall out from underneath me. At that time, I wasn't sure if I was going to be able to get the chemotherapy that my doctor wanted me to get, because I didn't know how financially we were going to be able to make that work. I never had health insurance at all in my life, not even through a job, just because it cost so much money. I couldn't even afford to have it taken out of my paycheck, when I was serving full time and working for myself, just worrying about all of the debt, the injections, which were $400 a day. If I didn't get those injections to boost my white blood cells, then my treatment would have been spaced out, and the further out you're spacing your treatment, the less effective it is. And so all of those things are going through my mind. How am I even going to pay for the chemotherapy medicine? And on top of that, all these other medications, steroids, anti-nausea pills, and that's not even getting into the surgeries yet either. I will honestly say the financial burden of it was more frightening to me than the cancer diagnosis itself. I had to figure out financially how I was going to be able to get through it.
So unfortunately, so many of our community members cannot make enough on those minimum wage jobs to receive subsidies on the marketplace. They have to decide between healthcare and work, or healthcare and utilities, or healthcare and groceries.
Landscaping, it was a big part of my life. That was my yard in Illinois. I had a pond. That's my grandson. He's walking through all my flowers. I had a pathway that went out that way. There's the pond. We dug that out myself. That's what I used to do. I couldn't do that now.
One of the women that we have seen here at Thrive and have tried to help, her name is Linda.
I'm sure the cold weather doesn't help with that.
No, it does not.
Hey, Linda, this is Greta.
Oh, hi.
Greta.
Nice to meet you.
Linda, and Greta's going to be assisting you today.
I'll just take that.
I had a stroke and I had lived in Illinois. I could not be alone for a month. I had to be with someone at all times. And so my family came up, my mom, my sister, and brought me home. I'm originally from here.
Okay, so you don't have any insurance right now?
No, I was approved for Medicaid in Illinois, but it's been brought to my attention that you cannot transfer it.
Yeah, in Kansas, there's only 3 ways you qualify for it. You have to be a child, have to be elderly, disabled, or pregnant.
She can't get health care. She's selling her goods, everything she owns, just to try and get those doctor's appointments. When Linda had her stroke, it affected the left side of her body. And if she could have received care, physical therapy, as she should have, she would be able to do so much more. And instead, she will now, for the rest of her life, have very limited use of that side of her body.
As physicians, we have guidelines that suggest that this is the right treatment, but individuals can't afford what the guidelines suggest.
To be honest, I just feel that I don't matter. I don't know what it takes to get someone here in this state to help you. With all the issues, so many times I feel like I'm existing and I'm just not really living my life to the potential I could have had. That's sort of how I feel about Kansas right now. My Aunt Janet saw this when we were shopping one day, and it's just ironic. It is good to be home with family, but now I'm without health care. So I could have been in Illinois alone and not have family support, but then I'm home with family and now I have no health care support. So it's kind of double-edged sword. It's not Republican, it's not Democratic, it's a humanitarian issue. It's people are dying, people are sick, they need help, and it's a human thing. It's caring, it's helping others, getting them through the worst periods of their lives. I know that people here have compassion. I know they believe in helping each other, and this should just be one of those ways that they help.
One of the issues she has right now is she has diabetes and she needs shots in her eyes that she cannot get. And her comment to us was, well, I guess if I go blind, they'll have to cover me because I will officially be disabled then.
Every 6 months you have to have the shots. They are $2,000 to $3,000 per eye, and I need to have that done on both.
You have an illness, you become disabled, you can't work any longer, now you can get Medicaid. They want to work. They want to put food on the table for themselves and their families.
We're talking about people working in factories and restaurants. We're talking about farmers, working class individuals and families. That is the typical demographic that you are going to see that would benefit from expanding Medicaid in Kansas.
My name is Anthony Rinaldo. I live in Kansas City. I work at the counter at a plumbing wholesale company. I'm a single dad. My son Braden is 11 years old.
How was school?
Good.
Yeah? What did you do?
Played kickball.
Well, that's not a subject.
I did math.
He tells me he likes math in school. He loves music. He loves PE. I think every kid loves PE. I want Braden to just know that he has a father that loves him and cares for him.
Who do you think the Chiefs are going to play in the Super Bowl?
The Raiders.
They can't. They're in the same division.
The Texans.
They're AFC.
Fine, the Dolphins.
Dolphins?
Yes.
There you go.
This is me and Braden when he was about 6 years old. At the time, he was going into second grade. He was not at a second grade level as far as his learning, his social skills, his language. Couldn't read in full sentences, couldn't speak in full sentences. It was frustrating. There was something going on with him that I needed to get figured out. I took Braden to it's an evaluation center for kids. We then found out that he's got ADHD, and then he's got a couple mood disorders, all kinds of medical things going on with him. The recommendations that we got were he needed to have multiple medications and a couple different therapists that were needed to kind of help him branch out and be able to grow. Yeah, the cost for everything that he was going to need was probably 50 to 60% of my income. It was going to be a big hit. I started looking on the internet as far as some assistance.
$350. Okay.
I filled out the Medicaid application. We got accepted. It was a great feeling when that happened because we definitely wouldn't be here without it. First starting it, I was kind of, well, what is this going to say about the working class? But it's not even like that.
Braden, time for your meds.
I've never not worked a day in my life. I just knew what it was going to take. I needed to get it done for him. Now I've been able to see the growth.
Spell table. Shut.
He's done a complete 180 on his everyday function, his school. Every report that I get from the school has been nothing but good things. He's now in 5th grade, and he's only a grade behind. He's still even doing some 5th grade stuff, which is awesome. There are days where I want to pull hair out, but, I look at the bigger picture, and the bigger picture is, what can I do today to help Braden?
I had read a book about a guy who'd had a brain tumor. His odds of surviving that brain tumor were 1%. And he said he just always put himself in that 1%. And so immediately I'm like, I'm the percent of people who are going to survive through this. When I was diagnosed and I was in contact with the early detection works, some people started talking about Medicaid. I never even heard that that was an option for somebody like me. Every state is held responsible for giving Medicaid to women who are diagnosed with breast or cervical cancer if they fall under a certain poverty line and don't have any insurance coverage. I essentially won the cancer lottery. I got the right kind of cancer to be able to qualify for this. Within a few weeks, I got the news that I was going to be covered by Medicaid. I just remember it was a huge relief. I can get the treatment that I need.
There is a consequence to a community, not just the individual, but to the entire community when people can't access good health care. It is a big economic impact.
There are 107 rural hospitals in Kansas, and only 9 of them that are in the black. Now we have about 29 hospitals that one more hit and they're done. So if this hospital closes down, 440 jobs are gone. So what happens? Well, gas, people aren't buying it. That section's gone. Restaurants, they lose business. Cities lose taxes. People don't want to live there anymore, so therefore the price of houses goes down. Nobody wants to move there because it doesn't have a hospital. And if there's one thing about healthcare, when you're deathly ill or you had a traumatic car accident, there's like a window of time where things can happen for the best or for the worst.
I live in Durham, Kansas, in the middle of nowhere. Do not blink. You will drive right by this town. There's 105 people here, and it's just a nice little quiet place. You feel safe. We want beautiful skies, our beautiful sunrises, sunsets. We work our butts off to keep it that way. However, the scary part happens when all of a sudden the thing you never ever think would happen happens, and it does come back abnormal. I'm diagnosed with pre-cervical cancer. What am I going to do? How am I going to know I'm going to be safe? I've got a 14-year-old, and I'm in the middle of nowhere. And so just to travel to try and find healthcare, like an office, it's not exactly the best situation.
When people think of rural communities, they think that we're very small, and so it'd be very easy to walk wherever you need to go, and that's so not true. We're spread over 505 square miles in Allen County alone.
Nothing comes with insurance that I've done. I have to go out and find that on my own, and with my income, there's just no way that I can afford any of those payments. An insurance premium monthly would be devastating, and I want to raise my kids in the country. I'm not a city person, and I shouldn't have to go to the city just to find health care.
Hey guys! Hey! Oh my gosh, I missed you. After finishing treatment, my sister Sarah had given birth to her first son. Quack, quack. Now my sister has 3 sons and 1 daughter, and they're really what I live for.
It looks dark, but it's actually really light, but it doesn't matter.
I moved up to Overland Park with the idea that I wanted to do something bigger with my life. I went back, finished high school.
Everybody's gonna get one. Yeah, maybe I could start you off with a couple of ice waters.
My life now, I work full-time at a restaurant as a server. Because of Medicaid, I'm the first person in my family to attend college, so I'm able to focus on that instead of worrying about my medical debt. After getting diagnosed with breast cancer, I started to interact with other ladies at the cancer center, and I was shocked to learn, even though I fell well below the poverty line needed to qualify for the Medicaid, if I'd had any other kind of cancer, I wouldn't have qualified for Medicaid.
Just kind of like bounce ideas off you.
A lot of people, they won't even go to the doctor because they know they can't afford it. I don't think that based on insurance or money, anybody should be denied quality health care.
We have the resources, we have the knowledge, we have the doctors, we have what we need to take care of people, and yet they can't access that care. The impact is not just on the individual. If you change that person's life, it's going to change all the lives around them. And it's going to have a bigger impact in their community.
Good morning. Thank you guys for being here. So we'll have a little bit of moderated discussion. I've got a few questions for our esteemed panel, and then we'll open it up to the audience for questions. The goal with this film is to invite dialogue and learning, and so we want an open conversation. We want to be open to different points of view, but we don't want any personal attacks, and we'd like to keep this conversation focused on healthcare and Medicaid. And one other note, this event is intended to foster awareness and education. We'd like to avoid any comments that suggest lobbying or direct advocacy, okay? So, with that, Stephanie.
Yes.
Good morning. Can you tell us a little bit about why you wanted to participate in this project?
Well, I just think that I'm a Medicaid success story, and I wanted to show people, the good that can come out of Medicaid, and really how it does affect our community and how it can help, people who are living in our communities.
Yeah, that's great. It's striking to hear you in the film say that you feel like you won the cancer lottery when you were diagnosed with breast cancer at 30. Can you tell us a little bit more about why you feel you're lucky to have breast cancer?
Yeah, I mean, nobody ever wants to say they're lucky to get any kind of disease like that, but essentially I had the right kind of cancer to qualify for the Medicaid insurance. Had I had any other kind of cancer, I would not have been able to get that insurance, and it would have greatly affected the outcome of my treatment.
Jordan, turn to you. So can you tell me a little bit more about why Medicaid is so important for the American Cancer Society, Cancer Action Network?
Sure. I mean, Stephanie's story perfectly illustrates why the American Cancer Society is involved in this work and why Medicaid is so important. But at the same time that we are excited for success stories where people like Stephanie were able to get access to the treatment they needed to beat cancer. We also saw Gina's story where she's been diagnosed with pre-cervical cancer. She's uninsured, and we know that with access to health insurance, she would be able to manage that and hopefully, catch cancer early when it's easier to beat and less expensive to treat. And so I think those two stories really demonstrate why it's so important for us to be involved. Medicaid is health insurance, and health insurance helps people be healthy enough to go to work, go to college, support their families, pay their bills. So it's really important for us that people have access to it.
And I think there's often a perception that there is a safety net that's there for people who get really sick and for people who have cancer. And for folks outside of the breast and cervical program, is that always the case?
No. No, Stephanie is right when she says that she got the correct kind of cancer in order to have care. She'd been diagnosed with, colon cancer, brain cancer, lung cancer, anything outside of breast or cervical. She would have fallen, into the coverage gap, and she would not have had access to treatment.
Yeah. And can you explain what you mean by the coverage gap?
Sure. So there's a population in our state and other states that have not yet expanded their Medicaid programs that makes too much money or is not eligible for Medicaid for categorical purposes. They're not a child, a low-income parent, blind or disabled, and therefore they don't qualify for coverage through Medicaid. But they also make not enough money to qualify for subsidies or help pay for private health insurance through the health insurance marketplace. So they're kind of stuck in this middle ground where there is not an affordable option to them. Most of this population, the overwhelming majority of this population, is working, but they're working jobs that don't offer them healthcare benefits. So a lot of times it's multiple hourly jobs where they're just not offered health insurance through their employer.
Thank you. Dr. Freelove, can you tell us a little bit more about the challenges for access to care in rural parts of the state? We saw a little bit of that in the film, but can you tell us a little more about the challenges?
Sure. Access to care in general it can be difficult, especially if you're not insured or living in poverty. And then when you throw in the rural component of that, just the lack of other resources. Sometimes there's not even a doctor or a hospital or a clinic for you to go to in your town. You may have to drive 20, 30, 40, 50 miles and to get that care. And that's just puts another barrier in the way, especially when you're working 3 jobs and you're scraping by, and if you don't show up for one of those jobs, maybe you don't have that job any longer. And the 3 jobs combined are enough to put food on your table and clothes on your back and that of your kids, but is it going to be enough to pay for the gas to drive that far? Those kind of things. So there are a lot of barriers that people face to accessing care, especially in the rural areas.
Yeah. And can you tell us a little more about the role that hospitals play in small towns and rural communities?
Yeah, sure. So it was kind of highlighted in the film. The hospitals are incredibly important to small towns, not just for the access to health care, but from an economic standpoint. If you want to get people in a small town riled up, you start talking about school consolidation and closing their hospital, because those are generally 2 of the largest employers in that town, and they provide critical services for the people in that town. And if those towns don't have that, just like he said in the film, you lose a significant portion of the economy in that town, and other things go away. People don't want to come back and live. People don't want to move there and live because they can't.
Yeah. And a lot of us, I know I get health insurance through my employer, but we see in the film that there are people who are working and don't. So do you see that a lot? What does that look like for working people who are still uninsured? Sure. That's actually why I started getting involved in trying to give a voice to those patients. For every story that is a success story, we see 3 or 4 in our clinic that aren't, and that's hard when you have people who are working and they're working hard and they're doing jobs that a lot of other people wouldn't do, and they just don't make enough, but they also make too much. Mm-hmm. And to not be able to provide those people care when you're capable of it. I mean, like I said, you have the knowledge, you have the technology, you have the resources available, and they're right there, but they're just a little bit out of reach, and that is challenging as a physician, and it's incredibly frustrating as a physician. And when you see some bad outcomes just because somebody didn't have health insurance and they had the wrong kind of cancer, or they had the right kind of cancer and didn't know it was the right kind of cancer, so they come in and it's a horrible thing as a physician when you can diagnose cancer just by looking at it. That's not something that any physician wants to have happen. It's happened 4 times in my career, and that's a travesty. Yeah. And when you talk about uninsured adults who are working, but they're forgoing medical treatment because they don't have health insurance, what happens? Do we see a lot of people like Gina who are no longer able to work because they couldn't get health care? Yeah, and that's also kind of a horrible catch-22 when you have somebody who's working and they're trying to do right by their family and put food on the table and make a living and contribute to society, and then they get ill. Sometimes it's cancer, sometimes it's a chronic disease like diabetes, and they can't get treated until it's so bad that they can no longer work, and they're qualified for disability, and then now we can treat them, and it's too late now. I've told a story before when given testimony about Medicaid and the importance of Medicaid and Medicaid expansion, about a gentleman that I took care of a few years ago who was a truck driver and made too much, didn't make enough, got diabetes, couldn't afford the medications, and we worked hard to try and help him as much as we could, and it got to the point where he started suffering complications from his diabetes. He could no longer drive. Fell into a depression because he couldn't work. Just a never-ending spiral downward from there, because that's when you get to that point, it's incredibly difficult to take care of yourself. And that gentleman actually ended up dying from complications of diabetes. And I feel like if we had access to the appropriate care early enough, mm-hmm. He'd still be out there driving truck. Yeah. And one other thing we hear a lot about kind of with work and health insurance is that maybe people on Medicaid should be required to work. Mm-hmm. But we see in the film a lot of people who are impacted or could be impacted are already working. Mm-hmm. So what are some of the challenges that come with some of the proposals to require Medicaid enrollees to be working?
Sure. As you saw in the film, and as we know, the majority of the population that is eligible, should we expand Medicaid in Kansas, is already working. So the first question is, what problem are we trying to solve with a work requirement? These folks are working already. But the second part of that is that there are a lot of consequences that maybe be unintended that come with imposing a work requirement. And Arkansas is a state where we see how that can play out. We know for a fact that because folks didn't understand the reporting requirement, didn't understand that they had to report, found the system for reporting work to be incredibly confusing or hard to access. People who were in active treatment for cancer or were managing a chronic illness lost their health insurance, which makes it incredibly hard to continue managing and can delay treatment. Stephanie talks about how important the timing of her treatment was. If if someone finds themselves in a situation where they're working an hourly job, they don't have control of their schedule, they might fall under the hourly requirement for that month, lose their coverage, they're delaying treatment. We're prolonging the amount of time it takes to help them beat their disease. We're putting their life in jeopardy. So there are a lot of consequences that can come with something like a work requirement. And as I said before, we know that the majority of people who are in this population are working. They want to work. It's something they're already doing.
I would just add, I was able to work through my treatment, and had I not had access to the prescriptions that I needed to keep me from just being sick all the time, I would not have been able to continue to work while I was getting treatment. So not only did was I able to access the medications I needed to keep my treatment on a timely path, but also kept me feeling well enough that I was able to work during that time.
Yep. Having health insurance is a work support. It's what helps people be able to go to work. So it's incredibly important that we make sure that they have access to meaningful coverage and are able to manage their health.
Yeah. One more question, and then I'll open it up to the audience. I think, Dr. Freelove, we heard you talking in the film about how generous Kansans are, and we see, things like the pickle jars at coffee shops and corner stores where people want to help their neighbors. What are the limits of that? Is that level of charity care or safety net clinics, is that enough?
No is the easy answer. It's not nearly enough. There's just not a big enough pickle jar, it's I would hazard to guess, if you sat and watched that pickle jar, the people who put money in that pickle jar are people who at some point in their life might need that pickle jar themselves. I think most people here know about our clinic, the Salina Family Healthcare Center. We're an FQHC and part of that safety net clinic. And we do, we see everybody regardless of their ability to pay. We're not in the business of putting people into medical bankruptcy. Our doors are open and everybody gets high quality care who walks through it. There are challenges, though, to providing that high quality of care when resources are limited for that patient. And we've got a lot of people who can work hard and help find resources, but it adds a layer of complexity and it adds costs to the care. When that cost is uncompensated, that makes it even harder to provide. So there are limitations, and we, even here in Salina, while I feel like we're doing a great job, there's still a fairly significant portion of the population who's uninsured, who aren't getting health care through us, which means they're either getting it incredibly expensively through the emergency room in a crisis situation, which is the wrong time to try and access. I mean, it's right to go get health care when you need it and you're in a healthcare crisis, but when it's things that are preventable, it's the wrong time to wait until it's a crisis, or they're not getting it at all, and that's the case all across Kansas.
And maybe as kind of a transition to the audience questions, while you're all thinking about any questions you have for folks here on the panel, reactions, I'll share kind of one of my thoughts. I was fortunate enough to travel around with the filmmaker as we went into people's homes and places of work and worship, and conducted all of these interviews. And it was so eye-opening to see the whole person kind of throughout their existence, beyond the statistics or the income level or their healthcare diagnosis, to really see people kind of for the whole person that they are. And I think when we talk about policy change and policy proposals, we can lose sight of the real people that are impacted, and think more about the statistics or the big numbers or the policy briefs or whatever. So with that, I'd like to open it up for questions. You can just kind of holler out from wherever you are, and just ask that you keep it respectful and focused on the issues of health and healthcare. Yes, April.
Stephanie,
I'm just curious, there's a point in the film where you say that you're able to attend college because of Medicaid. Could you talk a little bit about that and how that connection works?
Yeah, I mean, obviously, Medicaid has nothing to do with the funding of my college, but because of Medicaid, I am healthy enough to focus on my future. I'm not so concerned about my health. I know that I'm healthy. I know that my health care, for the most part, is not a worry of mine anymore. And so I feel comfortable enough looking to the future, focusing on other things other than my cancer diagnosis and just moving forward. And so I enrolled in Johnson County Community College, and I'm loving it so far. So,
if I can add to that, so we're one of 14 states that haven't expanded, and so there's a lot of evidence now where they're looking at the impact of expansion in other states. And one of the things that they're seeing is in states that have expansion, that financial stability is a very common theme, and they're seeing reductions in debt in patients who are formerly uninsured, and it's not just medical debt; it's debt in general. So. Eliminate the medical debt, able to focus on other debt, and improve that financial footing that those individuals and families are on, which is the first step really in kind of fighting that cycle of poverty as well. So it does have broad-reaching impact beyond just helping access healthcare.
And as Stephanie mentioned, she is a full-time student and full-time employed, so we really appreciate her getting up early on a Saturday morning to drive over to Salina to hang out with you all.
I got off work at midnight last night.
Oh,
so.
that's great.
Should get some coffee in here for you.
Yes. Oh, I already had some. Any other questions, reactions?
Yes.
A thank you and a question. The thank you is for pooling your resources to tell the stories of a lot of these folks, because they don't have the deep-pocketed lobbying groups that the other side has, obviously. My question is that even prior to the whole issue of Medicaid expansion under the Affordable Care Act, Kansas, I've always read, has been one of the stingiest states in terms of being able to qualify for Medicaid. Do you have enough statistical knowledge of that to speak to it for a minute, or?
Yeah, sure. And maybe a few of the lawmakers, you might be able to expand on this better than I am. I in terms of where we rank on a list, I couldn't give you the number, but I do know that our qualifications are some of the most stringent in the country. And I think at the beginning of the film, you saw a caption that read, what your income would have to be for, I think, a mother of three. To qualify for Medicaid, and it's an incredibly low amount to be able to qualify for Medicaid coverage. Correct me if I'm wrong, but I think what I was told that if you're working half-time at a part-time job, you make too much money to qualify for Medicaid. So imagine supporting a family on that income and not being able to access health insurance.
And I would add, we hear a lot about the population of adults that would benefit from Medicaid expansion being childless adults,
right?
Able-bodied,
right?
But what we see is that a lot of the people who would benefit do have children. Their incomes are just a little bit too high to qualify as a parent or caregiver to a child. And a lot of people do have health problems or are on their way to being disabled if they aren't able to get the health care.
Yes. I'm sorry. I just wanted to add too, and maybe somebody else in the audience could help me fill this information in. But I think even if you are disabled, you're not necessarily going to get Medicaid. And I think a lot of times you still have to pay for that Medicaid coverage. Am I correct on that? Yeah. Even if you're a single mom with 2 children, you might be getting disability. You might still not be able to afford the Medicaid that is offered to you.
Representative Kincannon, yes.
Maybe you were pointing behind.
No.
Yeah, not only is it difficult to qualify, but then we are one of the lowest states in the country in what we reimburse to our providers. And I was thinking about this question directed at Dr. Freeland, you know, I kind of have my own answer to it, but I'd like you to respond to the people who oppose expanding Medicaid talk about the reimbursement rates are so low. Why does this matter to you, and how would that help you keep the doors open to your clinic or our hospital in Beloit?
Yeah, and that's true. Medicaid is not a great payer in the state of Kansas for most private providers. But you can, the way I look at it is, so you provide a service that costs you $100 to provide. You can get paid $0 or you can get paid $40, and you can see nobody at $0. You can maybe afford to see 10 people at $0. You can maybe see 30 or 40 people at $40. So while it doesn't necessarily make it whole, it helps. It helps stretch that ability to provide care. For specific entities like FQHCs like mine, the reimbursement structure is such that Medicaid actually is a very good payer. So for us, it would probably move about 2/3 of our uninsured patients from being uninsured and coming in and us writing off the majority of their care to being paid essentially the cost of what it is that it requires of us to provide that care. So that allows us to grow, to add satellite clinics, to add providers, to improve that access for patients with Medicaid or who are still uninsured. So it's incredibly important for clinics like ours and the others in the safety net that are paid a little bit differently. And that includes rural hospitals, the critical access hospitals and rural health clinics, which is what probably the majority of the small towns in Kansas have. If they have a hospital and a clinic, they're probably a critical access hospital and a rural health center. And that reimbursement is a little bit different and a little bit better than what a traditional practice might get from Medicaid. So again, those dollars get stretched a little bit further. And it really can help stabilize some of those rural providers who are in kind of dire need, dire financial straits. And that's what they've seen in other states where it's been expanded. There has been improvement in the financial stability of hospitals in general. So that's all sizes of hospitals. But it has had a disproportionately larger positive impact on hospitals and clinics in rural settings.
Yeah.
I'm Trent Davis. I'm a practicing physician here in Salina, and doctors have to see sick people, particularly in emergency rooms in hospitals, and it is a question of getting paid something or getting paid nothing. But when that same person comes back to the office, I can absorb the time that it takes to see someone, but I can't pay for the CAT scan, can't pay for their MRI scan, can't get their medicines. So they end up being officially non-compliant with care. And the problem is they just don't have the money. Big example in Kansas is we're the only state in the United States for which Medicaid will not pay for a sleep study. But look at how many of our accidents are caused by people falling asleep at the wheel, how many chronic headaches, how many people not getting to work. Sick people can't work or not work well over a long period of time. So the practicing physician needs help with the patient getting their money. And even insured people are often in a situation where they can't afford medication. And it'd be nice if we had I'm an eternal liberal dreamer, but there should be a cap on how much of one's income is going to be devoted to health care. Because at some point you start making really tough decisions. And I can't tell you how many hours a week my nurse spends trying to find replacement for medicines that insurance companies won't pay for, or trying to find an organization or a country or any place in the world that will, that'll help secure medications.
Yeah, I can
elaborate a little bit here. Certainly from the standpoint of thinking about people facing cancer, the costs of cancer treatment and healthcare are big and are a big problem. We don't want to suggest that Medicaid or Medicaid expansion is going to fix everything. There are a lot of complex challenges in access to healthcare and cost of healthcare, and in rural healthcare in particular. We're making some progress with insurance coverage affordability and coverage for pre-existing conditions and things of that sort, out-of-pocket limits, but it's not enough. We need to keep moving in the right direction and not go backwards. Yes.
I can just throw out a remark about part of the legislature too. And on the Senate side, I think that, but I know, I can tell you without guessing that there are a majority of senators that would vote for Medicaid expansion next week if we were given that opportunity. And so, and there may be that opportunity, but you know, I just personally, I supported it back in 17, and I support it today, and you know, it just has so many benefits of you know, people just giving them the basic dignity of being in control of their own health, and empowering them so that when they get sick, but they're not really sick, they can run down to Stat Care and see someone for their illness and get it taken care of cheaply, and you know, and get back on their feet quickly. And all, it's a quality of life issue as well, because at some point you start going down this path of being ill. One illness kind of feeds into another, and pretty soon you've got this cascade that's not healthy. And on the other side of it, you know, it really irks me when we force our medical providers and physicians to provide health care and not be reimbursed for it. And I was with the Lieutenant Governor in Abilene on Thursday, touring the hospital, and he was also making a presentation about the value of Medicaid expansion and how it would affect that particular hospital. And I know quite a bit about the Abilene Hospital, not as much about Salina Regional, but there alone, they had approximately $700,000 in unpaid claims that would have been reimbursed by Medicaid expansion. And you know, we're talking about hospitals that can't continue to work at a deficit year after year after year without suffering some consequences. And they talk, there's over 100 rural hospitals in Kansas, and I do know that 29 of them are in danger of closing. And that would be a tremendous loss. And most of those are west of us. But there are some that are east of us too. But in most cases, they're in the more rural parts of Kansas. And so we have a lot to gain by considering Medicaid expansion. And I know it's going to happen. It's just a matter of when, I guess.
I might ask. Oh yeah, sorry. Yep. Great.
Representative Dirks here from Salina. I just want you to know that there have been many opportunities for us to be able to have passed Medicaid expansion, only to have been left at the door at the last minute, and it's been very frustrating for some of us who really realize the importance. You know, we moved from Wellington up to Salina when they finished dairy farming, and that particular hospital is just hanging on by a thread, trying to keep it open. And it's so important on these rural communities, because the thing that affects the rural communities the most is if you lose a school or a hospital, your community is, people move. They have to have health care, they have to have education for their kids. And that's so important to our rural communities here in Kansas. That's where our whole lifeblood has come from ancestry, from my ancestry here in Kansas up to today. And that's why, you know, things, presentations like this, to present to a group such as this, at least it helps in somewhat. And I really have to applaud the panel and those who put this on, because I've worked with them since 2012 in trying to get Medicaid expansion, and there's been other avenues all over the state. And hopefully those who are in attendance take it back to other people who are not here today or have not attended one of these. And that's why it's so important that you keep us on our toes. And maybe some of the other representatives who still are saying, no, kind of, well, I don't think so. Make it more of an affirmative yes vote the next time it comes up. And I understand that there is an opportunity perhaps coming up when we go back. And be rest assured that those of us who are in the audience today are certainly going to take heed and try to get it passed just as quickly as we can. So you have some pretty good representatives sitting over here, so thank you.
Thank you. I'd just like to follow up on that real quick. You talk about kind of sharing these stories with other people and continuing this conversation, this education. Jordan, do you want to tell us a little bit about kind of what's next for this campaign and the film?
Sure. So this campaign is a really, really big project, and we're really excited that it's launching here in Kansas first. So the documentary that you just saw is the first in a series, and our team is headed to Alabama next to film there and capture stories. But we also have a website, MedicaidCoversUs.org, where you can read more stories of people who have been impacted by Medicaid, see more resources that we have available. And if you're interested in having this conversation with others, the film is available for you to host your own screening, and we have plenty of tools for you to do that. And we encourage this conversation to happen other places.
It doesn't have to be a big fancy movie theater like this. You can invite your book club or your prayer group over and watch it on your TV at home. Great. Sorry, there's some more questions.
That's
Kim?
okay. I just wanted to say that a lot of people don't understand how big that gap is. My brother-in-law was working for the city, and it's a very hard job. Everything from replacing sewer lines to water lines and everything, and he got to the point where he could retire and he could no longer do the job because of his age and the wear and tear on your body. But then he retired, didn't make enough on retirement to afford insurance. Therefore, when he became sick, he actually had colon cancer and didn't know until it was too late. His wife got Lyme disease, which is a big, long lung disease that I don't even want to try and say the name, but she has to be on oxygen full time. She tried for Medicaid and she got it, but her spend down was $12,000. She makes $12,500. So we're talking it's going to leave her $500 to live on. My husband and I have been paying her oxygen that she has to have to live, and I say only, she's only on 5. I don't know how high her oxygen could go, but it's a life-saving necessity for her. And she couldn't even afford that because she can't get Medicaid that she could really afford. And it's hard to say that you have to be able to afford Medicaid. But when you have a $12,000 spend down, what are you supposed to do? You know, people don't realize how big that gap is and what they want from you to be able to afford their services.
I didn't even get that far with Medicaid. They said to me, sorry, it's something I'm still dealing with. They said to me, what's your income? He hasn't worked in 3 months. There's no income. Well, you've been living somehow, they said. Yeah, cashed in the 401k.
Love you, Mom.
And without the cold weather rule, we've been really screwed.
Yeah.
So the whole prove your income, you can't prove zero income.
It's heartbreaking, and the reality is that gap, which is sometimes described shorthand as too much to qualify under the existing program, there are a lot of people with no income who don't qualify for any medical care, and it's wrong. Yes. Sorry, sir.
A political question, maybe better
No
directed
lobbying,
to Senator
please.
Hardy than you, but I'm going to ask you first. So based on what I read, if this is true, it takes 24 votes to pull something out of committee onto the floor. to get it discussed, but it takes 27 votes to push that to an actual vote. And based on what newspapers say, they're not right 100% of the time, but there are 24 votes to do that, but it doesn't look like there's 27 votes to push it to an actual vote. So my question is, for you folks that are head counters, who are 3 potential votes that are out there?
I'm going to give that one to Jordan, but I'm also going to maybe ask her not to name names because we are focused on public education and not lobbying today, and I don't want the IRS to come track me down. But I would also encourage folks to continue No, you're fine. It's a fair question. I'd encourage folks to continue the conversation after today's event as well.
Yep, I think that's good advice. The conversation can continue after the event. And stop me if I like to tip over a line. So what I would say is that this procedural motion that you're referring to that could be taking place on Wednesday when they come back is something that, Senator Hardy said, there are enough senators who have been on the record who are supportive of this. We know that. We've counted those heads. The trouble is that this procedural motion is a little bit trickier sometimes for people to vote on. And that's where we get into a situation where the 24, 27, we're not exactly sure where we're at. So I'm not going to name names, but I think, this is a vote that's been taken before, and a lot of times with a quick Google search, you can find where people come down on this issue. And I would just encourage, if you're wondering if it's someone who represents you, I'm sure that maybe our lawmakers in the audience today might be able to have a conversation afterwards about, who might need a phone call.
Yes, ma'am.
What is the main, aside from the tax and the financial burden on this, what is another one of the main arguments against expansion? Is it only it's going to cost too much money?
So I would say that there are a lot of strong feelings on both sides of this issue, and there are strong ideological perspectives. But what I think is important and what sometimes gets lost is understanding the individual stories and the impact on individuals, families, communities that these policy changes have. And I've done time in Topeka, and I would say when you're in the State House and when you're really focused on the political process, it's really easy to lose sight of the human impact. And unfortunately, we don't always have films like this, and we can't find all of the Ginas and Lindas of the world to share their stories and really open themselves up in a very personal way to talk about the impact that this program has. And there are a lot of misperceptions and myths about what the Medicaid program is, who it serves, and that can make it harder for people making important decisions to understand who benefits and who's left out. When Stephanie talks about winning the cancer lottery, there are certainly people who think if you get really sick, if you get cancer, there's something there for you. But that's not really the case. That's not always reality.
Yeah, I would say we've been having this conversation for well over 5 years now, and still, when I'm in the State House, I still hear a lot of information that's just simply, I'm not sure where it comes from, but not exactly evidence-based. And so, I think that is why it's so important for folks to be engaged in the process. Sometimes it can feel like there's a force field around that State House and information's not really coming in and it's all right there. It's incredibly important for people to share stories and to, keep engaged.
I would go further and say it's not just that it's not evidence-based, it's just wrong. Yeah. It's just wrong thinking. And the longer it has been expanded in other places, the more the evidence supports and refutes most of those arguments. So to me, I really think it does come down to it's a human issue. Mm-hmm. And It is at times it's easy to lose focus on that or not see it as that when you're talking about millions of dollars and processes and policies and protocols. None of those are human lives until you meet a human life that it changes.
Yes, sir, right here.
And I think over time there's been a lot of misrepresentation of who the typical Medicaid recipient is. You could watch national media and think that it's poor minorities, people just recently came to the country, people who shouldn't be here, people who are lazy, people who are just bad citizens. But if you look at the folks that who are going to benefit, certainly in our state, these are folks who are lifelong, third, fourth generation Kansans, not that typical person that the media might think who are getting something for nothing. These are work, and they usually are people who are working.
Yeah.
And it really, there is a social aspect to the perception. I can't think of a single business in Kansas that would be put out of business with Medicaid expansion. And I don't think the amount that the state would have to chip in, correct me if I'm wrong, would put the state out of business. And we'd actually have a lot more to gain because our GMP would go up because more people would be working.
Yeah, we can see the experience of 36 other states that have already expanded Medicaid, and often what we find is that Medicaid expansion is revenue neutral or revenue positive. There are a lot of offsets that our state would experience and savings that they would experience, and so you're right, the benefits certainly seems to outweigh the cost.
Yes, Senator.
I was going to say from what I see, about approximately 100% of the discussion in Topeka is all about the money, and in part, there was about a 10-year period of time in Kansas that we've just gotten out of at around this 2017, to be specific, where the state was gutted. The highway fund was bankrupt. Agencies were gutted, just to make the budget balance. And starting in 2017, then we finally got to the point where we could start backfilling some of those agencies in mental health and education and highways, but it's like a 10-year process. And so on a certain level too, the legislature struggles with, well, how are we going to pay for this? It's only $50 million. Well, and it'll bring $500 million into the state from the feds. Well, it makes sense. But it's that $50 million that we want to know, well, where's it coming from? And so, I can understand that to a degree, but, everybody's coming to the legislature, higher ed, saying, can you pay us back what you didn't pay us the last 3 years? That's the kind of conversations we're having with a lot of agencies, and it's painful. But that's kind of where we are right now, too.
Yeah.
Are there any other investments that are paying 10 to 1 on the dollar?
Yeah, right. Yeah, I know. It makes all kinds of sense.
Yeah, I was going to just and maybe I shouldn't give away financial secrets about my organization, but there's a grant program that the state runs for safety net clinics, and we get about $250,000 a year out of that grant program. Medicaid expansion would probably mean about $700,000 to my clinic. So 70 of that would come from the state, and 630 of that would come from federal funds that are drawn down. I would much rather get the 70 from the state than the 250 from the state if it means I get $630,000 more dollars, because that's going to go so much further in reaching more people and providing more care for more patients.
Sometimes we don't know how to do the math, too, because I know that the health care in our criminal system right now is being funded through the state when it could be funded through Medicaid as well. So there are some other ways that that program could probably fund itself if you look for all of the different ways that the state would be impacted. It doesn't stop me.
Yeah. Well, and I will just add real quickly that it's challenging, I would imagine, for policymakers to consider the fiscal notes, the cost of whatever legislation they're considering. It's harder to see and grasp the cost of not doing anything. And what we've seen, particularly when we talk about some of the challenges with rural health care in Kansas, is how much of the costs are getting picked up locally, and the fact that cities and towns and counties are increasing local taxes to pay for something that could come from a different source.
And I think what's not difficult to grasp is that 3 hospitals have closed since January.
Yeah.
Well, I happen to work for Critical Access just west of here. You know, we just recently had a town hall meeting, you know, asking our residents, you know, what would they like to see us have? You know, they're requesting, you know, for things, you know, like cancer screenings and places, you know, where we can actually provide those services within our community. And basically, you know, the Medicaid expansion, if we can do that, you know, that would help us bring funds in so we can actually expand our facilities so we can bring those services to the community for which they're asking for. Because right now, you know, they've either got to come to Salina, they've got to go to Kansas City, they've got to go to Wichita, you know, to get those services that we're not able to provide locally. You know, so just to have that expansion alone would, you know, benefit, you know, not only our little critical access hospital, but the rural communities that we serve, that we have clinics in.
Yeah, if you go to MedicaidCoversUs.org, one of the stories you can read is from a clinic CEO in Louisiana who was able to add 60 staff positions at his clinic after that state expanded eligibility for Medicaid. There was demand and funding for it. Representative Kincannon?
Thank you. And I didn't say this earlier, but thank you for this.
Yeah.
This is a great opportunity to to see the film and to have some discussion. I just wanted to follow up just a little bit. For those of you who don't follow what we do in the legislature, what we've been talking about is a vote that needs to happen on the Senate side. What's happened already this session is that it did pass the House. We had to kind of do some maneuvers and some procedural type things, but it helps to know the rules. And we did, and had a lot of help behind us, but we did get it past the House, and it's currently sitting in, the bill that we have now is currently sitting in a health committee that the chairman has no intention of having a hearing or working, or maybe next year. They keep pushing it off to next year. But we took a really difficult vote this year, and we don't want that to go to waste. We want the Senate to follow through. You were talking about the number of votes. It would require 24 votes. It wouldn't have to require 27 votes to bring it up to above the line, is what we call it, when something's going to be debated. It wouldn't have to have 27 votes if the leadership would just let it happen. So that's where the real pressure needs to be, is on the leadership to let the debate happen. We don't have to pass it, and but let's see what the Senate wants to do. Let's see if they'll vote for it. We did pass Medicaid expansion 3 years ago, and the governor then vetoed it, and we came just a couple of votes short on the House side of overriding the veto. So, you know, that's kind of where it's at right now. The Appropriations Committee, that I sit on the House Appropriations Committee, and the committee deleted the entire $16 million that the governor appropriated for expansion. So, you know, we can find the money, but it's been taken out, and it's been agreed upon in ways and between ways and means.
And one thing I hope you'll think about both in the film and from these discussions is the human cost of delaying access to care. When you look at a story like Linda in Humboldt, who is going blind and knows she's going blind because she's not able to get the care she needs. Or some of Dr. Freelove's stories that are just heartbreaking, of people who either become disabled or die prematurely because they weren't able to get care. The exciting thing in cancer these days is that we know a lot more, and doctors are very well equipped to catch cancers early, prevent a lot of cancers entirely. I mean, we're making progress to eliminate cervical cancer, and a lot of colorectal cancers can be prevented, but you have to have coverage to get the screenings. And even if you save up to get a colonoscopy, if they find something and you're uninsured, you're not going to be able to get the follow-up care you need to prevent something from becoming cancer. So it's just so important to our organization's mission that people are able to get the care they need, so that we can prevent more cancers, save more lives.
I actually just have a question. I know Kai is not here, but one of our other directors from the movie, Isaac, is here, and I didn't know if he would want to come up and tell us what it was like to direct a scene from the movie. No, you don't want to? Was it fun?
Do you want to give a bow, Isaac? I will say, so if you remember, it was a real high point in the film when Stephanie knocks on the door and comes into her sister's house and all of the kids rush up to meet her. This is actually what happens all the time, but when we were filming at Stephanie's sister's home here in Salina, Isaac took the director's role for that scene. He mapped out how he wanted it to go. We did a couple of takes. He said action, and it was so great. We had so much footage that didn't make the film, but Isaac's scene certainly did. So let's give a special round of applause to Isaac. I was hoping to be here with us today, but her schedule didn't work out. But we're glad to have Isaac here to fill in as the assistant director. Okay, well, we're about out of time. But this has been a great conversation. Thank you all so much for joining us today. I'd like to give another thank you to the organizations that co-sponsored this event, the Alliance for Healthy Kansas, Community Care Network of Kansas, Kansas Academy of Family Physicians, and the Kansas Hospital Association. Big thank you to our panelists and sometimes movie stars for sharing your stories and your expertise. Big thank you to Misty and Heather and the Salina Arts Center Cinema for allowing us to use this fantastic space. And as I said earlier, Medicaid Covers Us is about having a conversation, and so we hope you will stay engaged in the conversation. We passed around some postcards. We would love to hear your feedback on the film, as well as how you would like to stay involved. We encourage you, as Jordan said, to bring this film to others that you know in your networks, personally, professionally, and have this conversation. So we'll have the full film online next week, and some resources to help you have conversations like this, so that more people can break down some of those barriers and misperceptions that they might have. So visit MedicaidCoversUs.org to find more information, including other stories from Kansas and around the country. Follow ACS CAN on Facebook and Twitter. Stay up to date for other local events and opportunities to make your voice heard. Thank you very much and have a great day.